Hello, gentlemen. If you're over 50, 60, or beyond, and you've noticed that your moments of intimacy feel different, specifically, if you experience the full sensation of pleasure, that moment of climax, but without the expected presence of seminal fluid, this message is absolutely essential for you. Maybe it happened just once, and it instantly triggered a knot of worry in your gut. Or perhaps it's a recurring, silent issue you've been carrying on your own, one of those things men tend to bury under pride, pushing it to the back of your mind with the quiet hope that it'll just fix itself. I'm Dr. Daniel Morgan, a urologist with over 12 years of experience focused specifically on men's vital health at every stage of life. I've sat across from hundreds of men just like you, strong, accomplished men who suddenly found themselves unsettled by something they couldn't explain and weren't quite ready to talk about. Today, I want to have a straight, honest conversation with you. No medical jargon walls, no vague reassurances, just direct, substantive answers. First things first, the change you're noticing in your body is not a verdict. It is not a sign that your masculinity has expired, that your intimate life is finished, or that your body is failing you in some irreversible way. I want you to hear that clearly, because in my experience, that fear, that silent, corrosive fear, is often worse than the condition itself. Think of it this way. This isn't a failure. It's a message your body is sending you, a detailed, specific message. And like any message that matters, it deserves to be decoded, not ignored. Stay with me, because in the next several minutes, we're going to walk through the surprising causes, the critical warning signs, and, most importantly, the concrete, manageable solutions that modern medicine has to offer. Solutions that can restore your peace of mind, your confidence, and your overall well-being. Before we get into what happens when the fluid is absent, let's do a quick, practical review of how this process is supposed to work. Think of your body's reproductive system as a precisely engineered machine, one where every component has a specific role and timing is everything. The testicles produce the sperm. The seminal vesicles contribute the bulk of the nourishing, protein-rich fluid. The prostate gland adds its own protective secretion. All of this is gathered and staged in the urethra. When climax hits, a coordinated sequence of powerful, rhythmic muscular contractions fires in sequence, propelling that fluid mixture forward and out. It's a rapid, synchronized event governed by nerves, glands, and muscles working in perfect coordination. Here's a distinction I cannot stress enough, gentlemen. Climax and ejaculation are not the same thing. Climax is the neurological event, the intense sensation of pleasure, governed entirely by your brain and central nervous system. Ejaculation is the mechanical act, the physical expulsion of fluid, governed by a separate, coordinated muscular and glandular system. For the vast majority of your life, these two events fire simultaneously, so seamlessly that they feel like one, but they are driven by entirely separate mechanisms. Understanding this distinction is key to understanding what's happening. Our focus today is a condition called dry ejaculation, the technical term for when a man reaches climax, experiences that characteristic peak of pleasure, but notices little to no seminal fluid is released. Men describe it to me in various ways: an empty finish, a hollow peak, a climax that feels real but leaves nothing behind. That gap between expectation and reality fuels real worry, and as a physician I respect that. You've always associated a physical result with that moment, and suddenly it's gone. But here's what I need you to hold on to. Your ability to feel pleasure remains intact, governed by your brain and nervous system, which have not changed. What has changed is in the mechanical delivery system. That is a meaningful distinction. It does not mean you've lost your drive, your virility, or your capacity for intimacy. It means part of the system has a specific, identifiable reason for the change. And identifiable reasons have solutions. Quick note, gentlemen, if you're finding this conversation valuable, go ahead and hit the like button. It tells the algorithm that this kind of content matters. Subscribe so you don't miss future discussions in this series, and drop a comment below. Tell me where in the world you're watching from. I've been genuinely moved by the sense of brotherhood I see in these comment sections. Men from different countries, different backgrounds, showing up for each other. That matters. Now, let's get into it. The 3 most common causes of dry ejaculation. Knowing the why isn't just satisfying. It's the foundation of getting your control back. Cause 1. The gatekeeper is too relaxed. Retrograde ejaculation, the single most common cause, is a condition called retrograde ejaculation, and once I explain the mechanics, most men immediately say, that actually makes sense. Here's the biology. Picture a small but critical muscular valve. Think of it as a gatekeeper, positioned at the exit of your bladder. During climax, this valve is supposed to clamp down firmly, ensuring that the seminal fluid has only one viable path, forward and out. But when this valve is too relaxed, when it doesn't close with the necessary force, the fluid follows the path of least resistance. It flows backward into the bladder. You experience the full neurological pleasure of climax. The sensation is real and complete, but because the fluid never exits, the result feels dry. Here's a practical clue that many men miss. After intimacy, if you notice your urine is cloudier than usual, that's not coincidence. That's the seminal fluid that entered your bladder now mixing with your urine. It's not dangerous, but it is a signal. What causes the valve to stop working properly? Most commonly, I see this after prostate or bladder surgery. The procedures themselves are medically successful. They accomplish exactly what they're designed to do, but they can affect the delicate nerve pathways that control that muscular gate. This is a known, well-documented outcome, not a surgical error. Additionally, certain medications prescribed for high blood pressure or benign prostatic hyperplasia and enlarged prostate work by relaxing smooth muscle throughout the body. The medication does its job on the blood vessels, but that same relaxing effect reaches the valve-controlling bladder exit. I remember a man, a retired engineer, meticulous, methodical, who came into my office after a successful prostate surgery deeply distressed. He felt, in his words, broken, when I explained to him that what he was experiencing was a purely mechanical alteration, functionally similar to a bypass valve in one of his old engineering schematics, and that his desire, his pleasure, and his capacity for intimacy were completely unaffected. I watched him physically exhale. That's the power of understanding. Information is medicine. Cause 2, the plumbing is blocked. Ductal obstruction, our second major cause, is a physical obstruction somewhere along the ducts, through which seminal fluid travels on its way out. Here's how to picture it. The seminal vesicles and accompanying glands are producing fluid normally. Everything upstream is functioning. But the delivery conduits, the small narrow ducts that carry that fluid forward, are blocked. The production is fine. The delivery is not. Volume drops sharply or disappears entirely. What causes these blockages? In my clinical experience, the most common culprits are scar tissue left behind by past infections, a case of prostatitis, inflammation of the prostate that when undertreated or was severe can leave behind fibrous tissue that narrows or blocks the ducts entirely. Less commonly, small calcifications, deposits similar to tiny stones, can form and obstruct the passage. The symptoms can be subtle, which is part of why men overlook this for so long. Some men report a new mild discomfort or pressure in the pelvic region during climax. Others notice that the fluid volume has been declining gradually over months or years, becoming thicker, then less abundant, then absent. That progressive pattern is an important piece of the history when I'm evaluating a patient. The encouraging news here is significant. Many of these obstructions are addressable. Depending on the nature and location of the blockage, targeted anti-inflammatory medications can be effective. In other cases, minimally invasive procedures can physically restore the flow. The machinery can often be cleared and put back in working order. Cause 3, the fuel is low. Hormonal factors, the third major area I evaluate, is hormonal, specifically the role of testosterone, the primary driver of male reproductive and sexual health. Here's the biology that most men aren't told clearly enough. Testosterone doesn't just regulate libido and sperm production. It is the foundational fuel for the optimal function of the prostate gland and the seminal vesicles, the two glands that collectively produce the overwhelming majority of seminal fluid volume. When testosterone levels fall significantly below optimal range, the entire reproductive support system slows down, production decreases, volume shrinks, and eventually the output can nearly disappear. Initially, you might simply notice a reduction in fluid volume, but as the deficiency deepens over time, other signals begin to appear: decreased desire, less firm erections, a reduction in the intensity and satisfaction of climax itself. On a broader physical and psychological level, men experience fatigue that doesn't respond to rest, shifts in mood and motivation. loss of muscle mass despite maintained exercise. These aren't isolated symptoms, they're a systemic pattern. And in my experience, men often attribute all of these to just getting older and accept them as inevitable. They're not. This condition has a name, hypogonadism. It is a treatable hormonal deficiency. A straightforward blood test, a morning testosterone panel, can confirm the diagnosis with precision. When the deficiency is confirmed and carefully managed testosterone replacement therapy is initiated under appropriate medical supervision, the results I've seen in my patients have been remarkable. Improved fluid production, restored libido and erectile quality, stronger energy levels, better mood, sharper mental clarity. The transformation is often comprehensive, not partial. Getting older does not mean accepting deterioration. It means being smart enough to investigate and address what's changing. Now, while the vast majority of dry ejaculation cases fall into these three manageable categories, I have an obligation as your physician to also address the cases that require more urgent attention. Because dry ejaculation can, in certain circumstances, be a red flag for something more serious. If dry ejaculation appears suddenly and without any obvious explanation, especially if it comes alongside pain, blood in the urine or the ejaculate, fever, or any loss of sensation in the genital region, do not wait. Do not search the internet for reassurance. Come in for an urgent urological evaluation. Certain neurological conditions, Parkinson's disease for instance, and poorly controlled, long-standing diabetes can significantly disrupt the nerve signals that govern ejaculation. In rare cases, specific urological cancers can interfere with the anatomy or nerve pathways involved. These scenarios are uncommon, but they require prompt attention. Early evaluation changes outcomes. Beyond the physical, I want to speak directly to something most medical conversations skip: the emotional weight of this experience. In 12 years of practice, I have seen how profoundly this affects men, not just physically, but at the level of identity. Men who have always associated the physical act and its result with their vitality, their performance, their masculinity. When that changes, feelings of inadequacy, frustration, and anxiety don't quietly stay in the bedroom. They seep into how you carry yourself day to day. I've seen men begin to withdraw from intimacy altogether, not because the desire is gone, but because they'd rather avoid the experience than risk feeling incomplete or being judged. Let me be direct with you about this. That withdrawal is the wrong move, and it is driven by a misunderstanding. Your ability to feel pleasure, to have and maintain erections, to experience genuine connection with a partner, none of that depends solely on the presence of seminal fluid. None of it. The most important thing I can offer any patient beyond diagnosis and treatment is this: understanding that a physiological change is not a personal failure. It lifts an enormous weight, and once that weight is lifted, men engage with their treatment, with their partners, and with their lives differently. Better, more fully. Let me leave you with a clear, actionable plan, because information without action is just noise. Step 1. Don't ignore it. Investigate it. A sudden or progressive onset of dry ejaculation is worth a visit to a urologist. I'm not talking about an elaborate workup. Often a thorough history, a physical examination, and a targeted blood or urine test are all that's needed to arrive at a clear, confident diagnosis. That clarity is worth every minute of the appointment. Step 2. Manage your chronic conditions with discipline. High blood pressure, diabetes, elevated cholesterol, these are not just cardiovascular concerns. They directly impact vascular health and nerve integrity, both of which are foundational to healthy sexual function. If you're not controlling these conditions actively, you are allowing them to quietly erode systems you want to preserve. Step 3. Break the silence. With your partner, with your doctor, with yourself. Men are conditioned to handle things quietly, to project strength by appearing unbothered. But silence about health issues is not strength. It's a strategy that costs you time, options, and peace of mind. Talking openly with your doctor about what you're experiencing is one of the most genuinely strong things you can do. It opens doors. It leads to answers. It leads to solutions. Let me close with this, gentlemen. The absence of ejaculate is not the end of your intimate life. It is not a verdict on your masculinity. It is a signal from a body that has been working hard for you for decades, a signal that deserves to be taken seriously, investigated professionally, and addressed with the full range of tools modern medicine provides. I've watched men walk out of my office with clear diagnoses and concrete action plans, and I've seen what happens. Confidence returns. Vitality returns. The fullness of life returns. Not because I handed them a cure, but because they finally stopped carrying the silence and started getting answers. Your vitality is not measured in milliliters of fluid. It is measured in your health, your connection, your engagement with the life you're still living, and the years still ahead of you. Don't let shame or doubt or pride keep you from getting the answers you deserve. Act now, while time and options are on your side. I'm Dr. Daniel Morgan, and I'll see you in the next one.